Assalamualaikum doctors. In this video I am discussing about the management portion of viral induced wheeze history. So first we will know that the difference between the viral induced wheeze, episodic and the multiple trigger wheeze or bronchial asthma. So triggers in viral induced wheeze is only during viral infections. Multiple trigger wheeze are plus minus cold weather, exercise, excitement, pets, smoking and pollens. And viral induced wheeze, the child will be normal, otherwise well between the attack. But in multiple trigger wheeze or bronchial asthma, interval symptoms are present between the exacerbations like wheeze, cough with activity, excitement and cold weather. Personal family history, there is viral induced wheeze, no personal or family history of atopic disorders. But in bronchial asthma, there is positive family history of the asthma or atopy. Viral induced wheeze age is less than 2 years, where asthma is more than 2 years. Now, what are the DD of wheezes? These are the primary wheeze and the secondary wheeze. Primary wheeze, number 1, 2 clinical categories. One is episodic or viral induced wheeze. That is wheeze only during the viral infections. Child is otherwise well, usually no personal or family history of atopic disorders. And the multiple trigger wheeze, that is wheeze with the multiple triggers including the viruses, pollen, animals and other allergens. Interval symptoms are present between the exacerbations, wheeze or cough with activity, excitement, cold weather, often a personal or family history of atopic disorders. Secondary wheeze due to underlying condition which cause wheezing. These are cystic fibrosis, immunodeficiency, ciliary dyskinesia, inhaled foreign body, gastroesophageal reflux disease, anatomical airway problems. Then history are symptoms from first day of the life, chronic wet cough, sudden onset of the symptoms, continuous unremitting symptoms, systemic illness. Physical examination shows digital clubbing, unusually severe chest deformity, stridor, fixed wheeze or asymmetric signs on auscultations, features of systemic disease. Then we are going the definition of viral induced wheeze. Preschool wheeze or wheezing in children 1 to 5 years of age is very common in UK. 1/3 of the children under 3 years of age and almost half of the children under 6 years of age have had at least one reported episode of wheeze. In viral induced wheeze, the chest becomes wheezy and tight when the child has viral infections, a cough, cold or chest infections. The wheeze may return each time your child has a cold. Usually children are well between the viral infections, but the wheeze can continue for some weeks after the infections. Preschool children are most likely to get viral induced wheeze. Does this mean the child has asthma? Viral induced wheeze is a similar but different condition from asthma, but some children will go on to develop asthma as they got older. So, how can we understand that the child will be go asthma? It is called asthma predictive index (API). Used for children 2 to 5 years of age with episode of wheeze during the first 3 years of life. At least one diagnosed by doctor. The prediction is like that it can predict those more likely to develop asthma if 4 wheezing exacerbation in past year with one physician confirmed episodes plus 1 major criteria or 2 major minor criteria. Major criteria are number 1 who will be develop asthma. These are parent history of asthma, doctor diagnosed of atopic dermatitis, sensitivity to allergens in the air as determined by the physician through positive skin test or blood test to allergens such as trees, grasses, weeds, molds or dust mite. So major criteria we understand that first of all positive family history, parents have atopic dermatitis history and there is child is in between the attack, the child is weak, child is sick. These are and he has the triggering factor not only viral infection, others are like pollen, dust. These are minor criteria are blood eosinophil more than 4%, wheezing unrelated to cold, doctor diagnosed allergic rhinitis, patient with allergy to milk, egg or peanut. So minor criteria are blood eosinophil more than 4%, allergic rhinitis, triggers are other than cold, and patient with have allergy to milk, egg or peanut. What is the treatment of the viral induced wheeze? First of all, a reliever inhaler such as salbutamol. So a reliever inhaler such as salbutamol, a blue color inhaler is prescribed to be given using a spacer. The medicine in the inhaler relaxes the airway in the chest and makes it easier to breathe. Number 2, steroid tablets, prednisolone. 2 to 3 days are used to settle down the inflammation in the chest. If children are very breathless, a nebulizer is sometimes used to give the medicine as a mist breath in form of a mask or mouthpiece. Number 3, Montelukast tablet and ipratropium inhalers. Montelukast tablet or ipratropium inhaler. Then number 4, most of the children with viral induced wheeze will not need a regular preventer inhaler. A few who get very frequent episode of wheeze will have a trial of this inhaler. So we understand the treatment of viral induced wheeze. First of all, we are giving nebulized inhaler with spacer, that is bronchodilator salbutamol. And second, we can give steroid inhaler or steroid tablet for 2 to 3 days to reduce the inflammations. Montelukast we will give and avoid the trigger. Most of the children of the viral induced wheeze will not need a regular preventive inhaler. So steroid tablet or prednisolone also we can give. Reliever inhalers such as salbutamol, one headline. Second is steroid tablet or prednisolone. Third is Montelukast tablet or ipratropium inhaler. And four is most of the children with viral induced wheeze will need not a regular preventer inhaler. Thank you.